Dean Russell.
Thank you, Chair. If I may come to you first, Professor Melville. I was just interested in the age profile of people who enter to then become a doctor. What's the sort of average age at the moment, would you say?
That's a really good question, and it might be helpful, if it would be helpful to you, we can follow it up with some detail so we can look at the age profile. Typically, of course, from UK graduation, the majority by far enter from school, so they're entering at 18, graduating at around 23. But you've got a group of graduate entry students who will be older, and then some mature students as well. So probably that profile would be helpful.
Because I'd be really interested in looking at the data, because what interests me is that often in life you might not realise you want to do something until you're older.
Indeed, yeah.
And I just wonder, is there any encouragement at the moment for people in their 30s, 40s or even 50s to go, actually, I actually realise I'd love to be a doctor. 7 years is a long time, but it seems to get shorter the older you get, at least I'm finding. And so is there an opportunity for people who want to change career, who might have skills that would be applicable to do that?
I mean, Malcolm might be able to speak a bit more to the recruitment, but from our point of view, age is no bar to becoming a doctor.
Yeah, absolutely. No, thank you, Malcolm.
So we have a small number of much older entrants, as Colin says, but it'll be 1 or 2% in their sort of 40s or 30s and beyond. And I think it is just the logistic challenges of the cost. Mm-hmm. An important thing to know is that if you've got a prior degree, even if your degree was taken outside the UK, unless you go into one of the graduate entry programs which is supported, you're not entitled to fees and loans. And our course is a 5-year course. About 35% of our students are graduates, which means they're working their way through the course. So it goes back to a lot of things. So they're earning while they learn. So that does sound like an apprenticeship, and that could be good if it was structured better, because they're mostly working in hospitality in the evenings and weekends and then during the holidays. So actually, if you said, well, why not extend it to a 44-week year and get them through a year, even a year quicker? Well, they wouldn't be able to afford to do it then, unless they're on one of the, if you like, authorised graduate entry programs. And there are lots of graduates who could enter, and some of them will be returning to education many years after they did their degree, which is now of no relevance.
That's my sort of question really, is that, is there an opportunity here that's being missed for people who've had careers, who've perhaps entered and perhaps dropped out after a year or two, to come back and get that training? Of course, we've still got to wait 5 years, 7 years for that to happen.
The biggest group who come in through graduate entry were insufficiently networked when they were 17 to do work placement in the local hospital or with the local GP, that then got onto their form and assisted their application because they were advantaged in their application. So picking up those people 3-4 years later when they've done a biomedical science degree or similar and getting them into medicine is a great way of widening participation, and there's a big pool of them. Because if you look at the RCP report, goes into this really well. At the moment we have much too higher standards. 3 A stars at A level is more than you need to study medicine, but somewhere around 2 Bs and a C or something like that for someone who's been to who's not had great disadvantage is where it starts to get difficult to get through a medical degree, because it is an academically rigorous degree, because if not just for the volume.
Absolutely.
There's a big cohort of students who've gone to good universities, done good degrees in biomedical science with 3 Bs or an AAP, who would be great for medicine. But unless they can get on, I'm sorry, I'm ranting a bit here. It's 1 in 30. It's about 32 applicants to each place for places like Warwick, where it's a graduate entry program. We have about 12 applicants per place, which is still a lot. But as I say, a third of our course are made up from people who've already got a degree and are really disadvantaged.
But thank you, and I think that's sort of the nub of my point really, is that ultimately there's lots of people who could be doctors who've currently probably been put off because they didn't think of it when they were 16.
Yeah.
I just wonder, I think there's perhaps an opportunity there for the government.
Yeah, absolutely. We would have to look at that.
Yeah, because that could help fill the gap.
There's an awful lot of work to do to widen access to, because we're predominantly still taking middle class kids who have all the advantages of their education.
So we're going to come on to that in the next
I'm sorry,
it's just running a bit short on time, Dean. Did you have any more?
I just had one quick question, if I could, to Dr. Patel, was just around the education for the future. Technology is an area I'm very passionate about, digital health. Are we training people for what will come in 10, 20 years' time? I know we can't predict everything, but use of AI and robotics and so on. Are people being prepared for that? And a bit brief, I guess, because I know the time's short. Thank you.
Probably not enough. And I think that the root of that is probably funding. Well, it definitely is funding. And if I may, can I just come back to your previous question? It was briefly touched on by others. Absolutely. We know there is a widening participation issue here, and some doctors take a while, some future doctors take a while to realise that medicine is for them. I think if we want the best doctors, regardless of age, then we need to invest in widening participation. I also think the NHS bursary needs a really good look at to see whether we are supporting medical graduates in the best way, medical students, sorry, in the best way possible, because it is a real personal expense to go through medical school. And I know I won't have the opportunity to answer this, but Sarah Owen, you asked a question specifically about IMGs. I am in the LMC UK conference here in York. This is a conference of GPs across the UK, and I have just heard from many doctors who are finishing, so they're CCT, finishing the end of their GP training, and they don't know whether they can get a job here as a fully qualified GP because of visa issues. So if there's one thing you were going to sort out for our international medical graduates, it'd be their visas. And it wouldn't just be visas for them as well. We also know that doctors who want to work here have issues with adult dependents. So parents who rely on them are a reason why, once qualified, they go back to their home countries because they can't afford to not be without them and not be caring for them. But our visa requirements make it very difficult for them to bring their parents over here. So there are some very quick issues here, some quick resolutions that we can concentrate towards, where we go back to retaining the medical workforce. Sorry, I just want to slip those in there.
Thank you. Successfully slipped in. Before we